Hi everyone, it's me, Melanie, your IVF nurse, and what you're going to be noticing about my YouTube topics are that it's going to be a series of videos that is going to specifically address your questions. So you may have noticed if you follow me on Instagram, and my Instagram is your IVF nurse, basically what I've been doing is just putting it out there that you've got questions, I've got answers. So reaching out to me via Instagram, personal message, or via my email with your questions, and I will reply to you directly right away as soon as the questions do come in, but I will be featuring them on my YouTube channel. Then you can hear what I have to say in my professional and personal opinion. With my initial post, what I had written was on my Instagram page, you've got questions, I've got answers. And this can be anything fertility. It may be something third-party related, so if you've been told you need an egg donor or a surrogate, it may be something just through timed intercourse cycles and insemination cycles. Questions, no matter how big or small, I will address. I will go through and reply to your questions as they come in, but I will be selecting them to be discussed in my YouTube videos going forward, just to kind of see what's out there, and anybody thinking of these questions can just look at the YouTube channel and then just get my professional opinion and some nursing feedback in regards to any questions you might have. So one question I did receive, and it was someone who was asking me my personal opinion. Basically, she had done an IVF cycle, and her first beta came back at a level of 9, and her progesterone was 22. Now, yes, 9 is positive. However, for a IVF beta, what clinically we like to see are numbers above 100. And betas can be anything from 100 plus, and I've seen betas that are like 1,000 initially. So the level of 9 is concerning. However, it is considered a low positive, and the clinic will continue to manage this number to see if it increases or if it should decrease. The progesterone level, theoretically, your body will use what it needs. Some clinics do not monitor progesterone levels. They think it's irrelevant, whereas a lot of clinics out there are very, it goes hand in hand with any blood work that they do, that they're checking progesterone levels. And usually progesterone for a clinic that is going to be checking it for an IVF pregnancy, they want to see it above 50. And usually if you're doing things like progesterone injections, we can see them in the hundreds in terms of progesterone values. Other forms of progesterone may yield a lower result for progesterone, but your body essentially will take what it needs and excrete the rest. Now, with the specific question, so she wanted to know, with a positive beta of 9 and her progesterone level of 22, in my experience, have I ever seen a viable pregnancy? Well, in about 18 years, I've seen it once, and that's how I replied to her. I want to be honest. And basically what happened was that the beta, off the top of my head, I really don't remember the exact value, but it was probably something like 20 or less than 20. And we had said, okay, let's continue to monitor it. And the beta just kind of teetered. It didn't double. And we just continued to watch it. We had finally decided, after a series of blood tests, to tell the patient to stop her medication, so the progesterone. And that should have brought a bleed. Well, what ended up happening was that she never got a period. And she ended up waiting about a month, then contacting the clinic and saying, look, I still haven't gotten a period, and I stopped my meds like a month ago. So we thought, okay, before giving her something to make her have a period, so women who don't have regular periods can go into their clinic and ask for like a pregnancy test, and they may choose to check other hormones as well. And then if the pregnancy test comes back negative, we would prescribe a medication called Provera. And Provera is essentially progesterone, but it will induce a period. And depending on your clinic, you may take this for anywhere from 5 to 10 days, and then usually you would get a period between a couple of days after stopping it, up to 2 weeks. Now, with this particular patient, she had stopped her meds and a month had passed and she still didn't get her period. So she came in, we did a blood test on her for pregnancy, and the value came back positive, high positive. The exact value I do not recall, but we ended up doing an ultrasound and she had a fetal heartbeat. She did go on to deliver a beautiful baby girl, but she, in 18 years, is the only story of that that I can recall out of my own personal experience in dealing with clients. Most times, a level of 9 is considered low, and it may mean that it's just resulting in a chemical pregnancy, so it usually will decline. Or if it continues to go up, then there's the risk of it being an ectopic pregnancy. So those things would be continued to be monitored in your office. So you do want to be making sure that you're listening to your clinic's instructions for follow-up. If you're having any pain, bleeding, you're going to know, because it's going to be excruciating. If you're having an ectopic pregnancy, you'll have like this gnawing kind of pain in your lower left or right abdominal area that will need to be investigated. But your clinic will manage you accordingly. You just need to be keen on your symptoms and be reaching out to your nurse coordinator or your physician to let them know how you're feeling and how you're doing. So I hope you found this interesting and helpful. If you do have any questions you'd like to ask me directly, yourivfnurse@gmail.com is my email. You can check out my webpage at www.yourivfnurse.com, and you can also follow me on my Instagram page at yourivfnurse. I would also like to let you all know that I have added fertility coaching to my list of services. So previously I had always listed my services as support packages. Injections, consultations are separate, but support packages for those that are going through IVF, for FETs, third party. I'm finding that some people are looking for a little bit of coaching, so they may not necessarily need an entire package, but they just want someone to check in, maybe review cycle monitoring results, those kinds of things really quickly. So those are now posted on my website, and you can take a look at those and see if you'd be interested in that. So it's smaller than a package for those that feel that they don't require an entire package or that constant hand holding throughout an entire cycle. They might just want someone to check in with now and then, just to, try and understand things a little bit better and get prepared for their follow-up appointments or meeting with the nurses or anything like that. So do feel free to check that out. Let me know what you think. Once again, feel free to check out my webpage, www.yourivfnurse.com.